Well, I'm happy to welcome Dr. Usman to our Autism Hope Summit this year. Dr. Usman was a speaker last year as well, and last year Dr. Usman talked about biofilms, and this time she's talking about pandas and PANS and autism, and so we really look forward to what Dr. Usman has to say about this topic. As a refresher, Dr. Usman is the director of True Health Medical Center in Naperville, Illinois, and owner of Pure Compounding Pharmacy. She has been using evidence-based integrative medical interventions to help children diagnosed with ADD, autism, gastrointestinal issues, and related disorders for over 15 years. And she currently serves on the executive board or the scientific advisory board, or perhaps both, of Generation Rescue, TACA, the Autism Hope Alliance, and as a faculty member of MAPS, which is the Medical Academy of Pediatric Special Needs. And Dr. Usman received her medical degree from Indiana University. Dr. Usman, thank you so much for joining us today.
Oh, you're welcome.
So happy to have you. And our topic today is pandas and PANS and autism. Why don't we start with the definition of what is pandas and PAN?
So, yeah, that is, it's not the panda bear that everybody kind of thinks of when you say the word pandas.
Right.
When I talk about it in, like, the public or general, people who don't have a concept of it, I start spouting off, well, pandas is pediatric, autoimmune, neuropsychiatric disorders associated with streptococcal infections. And they just kind of lose me.
Yeah.
This is such an acronym.
Understandable.
And then I go into, PANS is pediatric acute onset neuropsychiatric syndrome. Well, it's a long word for kind of a new and an emerging diagnosis that doctors like me that are kind of on the front lines of seeing kids with neuropsychiatric issues, we're just kind of seeing an epidemic of this new diagnosis. And it takes a while to explain all of what it really is. So I'm just kind of.
But there appears to be a relationship with autism, right? So maybe if you just kind of outline, how they're similar, maybe how they're different with autism, that'd be great.
Nobody's really studied that connection between pandas and autism. So again, in pandas and PANS, what it is some type of a neuropsychiatric autoimmune condition that's triggered by an infection, oftentimes. There are potentially non-infectious triggers like allergens or stress as well, but the classic would be a child got a strep infection and then later on had an acute or an abrupt onset of obsessive-compulsive behavior, anxiety, and anorexia, or stopped eating. And so that disorder and what's going on with our kids with autism, they overlap in the sense that they're both autoimmune kind of neuroinflammatory conditions. And so I think our kids with autism are more predisposed to being affected by these infections in this type of manner.
I see. So is there a big difference between pandas and PANS then?
Well, so initially when the diagnosis first came out, the main researcher in this area is Sue Suedo, who has done most all of the research on pandas. And her research goes back 30 years, where she was studying post-streptococcal sequelae called Sydenham's chorea, where children would get strep and then they would get this disorder called Sydenham's chorea, where they would have these weird movements in their arms and their face. It was almost like it looked like they were dancing. And she found that there was some metabolic changes in their brain. And as she started to study that, she realized there was a subset of children who didn't have the whole chorea-like movements, but had these kind of neuropsychiatric symptoms like obsessive-compulsive behaviors, anxiety, food restrictions, sensory issues, that the mechanism of what was happening was very similar to what was happening in Sydenham's chorea. So the initial diagnosis, the initial research was with strep. And over the years, her research and other people who have started to research this have found that there's other potential triggers. So there's other infectious triggers, and there's potential non-infectious triggers. And a couple years ago, she came out with a new paper kind of defining what Pandas is. And then there's an intermediate group called PITANS, which is Pediatric Infection-Triggered Autoimmune Neuropsychiatric Disorders. So it's this whole idea of infection-triggered neuropsych disorders. And then she expanded the definition to PANS, and now PANS is just kind of a broad definition, kind of encompassing the infections and the non-infectious triggers, and she calls PANS Pediatric Acute Onset Neuropsychiatric Syndrome. So, like, the key is this abrupt change, or this kind of, overnight change are these kids' behavior and their school performance and things like that.
Is there a typical age where this is seen more often?
The average age is around 6. So it's still considered a pediatric condition. And I've seen it in my practice in children, 2, 3, and in children during puberty as well.
Wow. And you've mentioned strep a couple of times.
Gamut, yeah. So that's Pandas.
Okay. So if it doesn't start with strep throat, then it could be a similar condition, such as under the umbrella of PANS, but with similar symptoms.
Exactly. Yeah.
Okay.
So the encompassing diagnosis PANS, the breakdown is infection versus non-infection triggers. Under the infection triggers, the prototype would be strep or Pandas, but there's other microbes that can trigger that, such as Mycoplasma and Lyme and Epstein-Barr virus and chickenpox or varicella.
Wow.
And under non-infectious triggers, under the non-infectious triggers, they talk a lot about, in the research, stress being a big trigger, potential trigger.
Wow.
Chronic stress. And then they use vague terms like environmental factors or metabolic disorders, but it has not been well defined exactly what those environmental factors are that could trigger this, or what exact metabolic disorders can trigger this acute onset. Remember, this is not a chronic thing, it's an acute onset.
Right.
The thing with this, too, is that these kids, it's like a roller coaster. They have these infections, then they kind of go downhill with these psychiatric issues, then they get better, and then they get another infection, and then they go downhill again, then they get better, then they have another infection, and then they go downhill again. And with each subsequent infection, their psychiatric symptoms might get worse. So it's kind of a lapsing and kind of remitting disorder. And when these children, flare, we use the term flare, where they have this trigger then you end up in like crisis mode where you try to figure out what the trigger is, and then you try to treat if there is an underlying infection. But I think the problem is, the kids with autism, they're already so, fragile. Their neuropsychiatric symptoms are already kind of on the top. So sometimes it's hard to recognize that they just had an acute regression. So I usually tell my families, I say, if your child regresses in any way, we need to be vigilant that there might have been a PANS or Pandas kind of flare.
Interesting. Yeah, I could see where it'd be harder to diagnose that in children with autism for sure. And do we understand? So because there is causes with both infection and non-infection, is something different happening metabolically, or is the culprit the same or similar with the cause of this regression, as you call it? Do we understand what's actually happening neurologically at that point?
Yeah. So again, there's a lot of controversy around this because there's just been, again, Sue Suedo and many of her colleagues kind of trying to explain this situation, and it's hard because when you think about in an infection, say you get strep, well, why would strep affect your brain?
Yeah.
The infections shouldn't get into your brain, so it's not like you have meningitis. So that's where it gets a little confusing. What happens is that these triggers create an autoimmune condition in the body, in the brain in particular. So what happens is the body fights the trigger and ends up fighting itself in the process. It's almost like an allergic reaction.
Right.
Right,
but this reaction is taking place in the brain. Allergic in
IgE sense, but allergic in that it's the body is fighting the strep. It produces antibodies to the strep. Those antibodies can get into the brain and attack a part of the brain called the basal ganglia, and that part of the brain controls these repetitive behaviors. And when that's affected, you have rigid behaviors, OCD, obsessive-compulsive behaviors, anxiety, a lot of excitation, a lot of like ADD-type symptoms. So it's really an autoimmune condition. There's not really an infection in the brain.
Right. So and like any other autoimmune condition, it can be challenging to treat, I'm sure, but we're going to get to that. Yeah.
Right. It's so difficult. And what happens is when the autoimmunity in the brain is turned on, that's called autoimmune encephalopathy or autoimmune encephalitis. It sets off a cascade. And again, Dr. Suedo and her group have studied that, you ask the question, what is the metabolism different? Well, they really haven't found it to be different. It sets off this cascade in the brain, which causes the brain to fight its own dopamine and fight its own brain cells. And so they're able to kind of measure dopamine 1 receptors, dopamine 2 receptor antibodies. It's called ganglioside antibodies and tubulin antibodies. All these are brain antibodies and are potentially elevated in this condition. And that autoimmunity then triggers an enzyme called CAM kinase 2 to be stimulated. And when CAM kinase 2 gets stimulated, that leads to inflammation in the brain and even more excitation and stimulation of the brain. So there's a lot of hyperactivity in this disorder. There's a lot of anxiety, and oftentimes sleep gets affected as well.
Mm-hmm. And some would wonder, especially with the type caused by infection, is it in any way contagious?
Well, infections, so the actual disease is not contagious. So if you have PANS or Pandas, the autoimmune component of that is not contagious. But if you have an active or an acute strep infection, yes, you are contagious. Sure. But what happens is this is post-strep, right? It's a post-streptococcal disorder. So they had strep oftentimes and no longer have it, and now the autoimmune component has kicked in. But with many of these kids, especially with our kids with autism, they have this immune dysregulation, and they don't get rid of infections, and infections might smolder in their system for a long time. And so it's still worthwhile looking for infections that may be acute and treatable. And so, that kind of goes into, well, how do you manage this? How do you treat this? Right. But it's not in itself, Pandas is not, or PANS is not contagious.
Okay, and that makes total sense. And we'll get to how do you treat it in just a moment. And you've touched on this, but the symptoms that parents look for include OCD behavior. You talked about the waving of the arms as well. Are there more symptoms that one could look for to see if possibly their child is struggling with this?
Yeah, there's a whole list of symptoms. And again, the two big ones, would be this acute, abrupt onset of obsessive-compulsive behaviors or an eating restriction where the child just refuses to eat. So that is the number one thing you look for. Then they have a list of symptoms that are what they call comorbid symptoms. They're in addition to the other two that I mentioned that are the two that you're looking for. Most of the kids have 4 or more of these comorbid conditions. So I'm going to list those comorbid conditions. Separation anxiety, emotional lability, which means up and down emotions from happy to sad for no reason, irritability, aggression, or oppositional behaviors, any kind of developmental or behavioral regression, deterioration of school performances, sensory or motor abnormalities, and the motor abnormalities look like movements that aren't controlled, and that would be a motor tic. And the classic in this case would be facial grimacing, eye blinking. If you have them put their hands out, like straight ahead in front of them, oftentimes it'll look like they're playing the piano. The fingers will be moving. And then other comorbid symptoms might be any kind of acute change in sleep patterns where they just can't sleep at all. And a big one that we find that parents don't recognize is my child was potty trained and now all of a sudden they're peeing on themselves or peeing very, very frequently. So for some reason, this also affects the kidney.
Okay. So there's a lot to look for. And in the absence of, based on this list, OCD or tics, they could have a number of these other comorbid symptoms, or perhaps what you described as a lack of will to eat. It's, in other words, the diagnosis doesn't require tics and OCD, does it?
No. I mean, anorexia is a big one. I think that, again, the symptoms with these kids is that they have acute food or liquid refusal. Some of them fear choking. It's like a phobia. They fear vomiting. Right. They'll just won't swallow. And they can't tolerate the smell or the texture of food. So that's a huge, what they call a major symptom. There's the OCD, separation anxiety, the anorexia. Those are major symptoms, and then some of the minor ones that I mentioned just now.
Okay, good. So let's get into the treatment then. Are there different options? Let's talk about what parents and caregivers can do and what doctors can do for these children.
Yeah, I think, there's a group called the Pandas Physicians Network, and there's a lot of information there for doctors. And so for parents, a lot of it is education, trying to educate themselves on what's happening with their children, and number one, recognizing that this might be happening. And then maybe even trying to educate their doctors, and the Pandas Physicians Network is an important, kind of an important place that people can get information. There's also Pandas Network in general. And I am on a committee in the state of Illinois called the Illinois Pandas and Pans Advisory Council. I'm on this committee with lawmakers and physicians and behavioralists and education people. And so we actually came out with a 2016 report. So again, if you go online and you go to the Illinois Pandas Pans Advisory Council 2016 report, you'll get a lot of this information. So again, it's overwhelming. You can find some of this stuff online. But in general, it's kind of, in traditional medicine, the approach is three-pronged. Number one, try to treat the source of the trigger. So if you can identify that trigger, if it's strep, if it's a virus, if it's mycoplasma, and that needs to be treated with antibiotics or antivirals. Number two is kids have a lot of neuropsych symptoms. They have a lot of mood and anxiety issues. And so that needs to be addressed. However, parents feel comfortable doing that. The consensus, again, in the committee would be like low-dose anti-anxiety medicines, low-dose mood stabilizers, low-dose SSRIs or serotonin reuptake inhibitors. But because I practice more holistic and integrative medicine, I don't always, go to those modalities. Number one.
Right.
And then number three is it's an autoimmune condition. And you have to kind of figure out how to address the immune system. And sometimes because the autoimmune issue is so severe, we need to calm down that autoimmunity. And in a traditional focused approach, they would use things like steroids, high-dose intravenous gamma globulin, and something called plasmapheresis, where you kind of try to, through kind of a filter the blood to remove these autoantibodies that are reacting to the brain proteins. So that is a traditional approach. And I just want to make people aware that even in a regular mainstream doctor's office, they're not up to date with this diagnosis, and they're not up to date with this traditional approach even.
You
so
mentioned
it gets difficult for families.
I'm sure. You mentioned in trying to address the mood issues with low-dose anti-anxiety meds or the like. There are alternative approaches to that you use. Could you expand on that a little bit?
I would love to, because I sit in these committees with mainstream doctors, and I think right now our big emphasis is education, just trying to educate the public, educate practitioners as to recognizing this really severe disorder. We think that 25% of childhood mental illness can be explained by PANS and PANDAS.
Really?
Yes.
Wow.
So if you don't look for it, you're not going to find it. But I'm coming from almost 20 years now in integrative medicine and dealing with children on the autism spectrum who have these neuroimmune inflammatory issues. And I think our biomedical or our functional approach works really well in this population where they have these comorbid conditions. So in my patient population, they have autism and PANS. And in some cases, I really think that the autism is misdiagnosed and it's really PANS or PANDAS and not autism. So again, it depends on the symptoms. It depends on this up and down kind of course to their symptoms. But there is a lot of, there are quite a few of my patients who are on the autism spectrum. They're doing pretty well. They're pretty stable. And then all of a sudden the parents call me and said, something happened to my kid with autism. They're just they just had this acute onset of OCD and anxiety. And I said, that's a PANS or PANDAS flare. So then we kind of go into our holistic approach on, how do we handle that? So again, the way we think about this is we want to calm down that immune inflammatory response. From my, coming from a PANS perspective, number one is we need to look for that infection, or we need to figure out what the trigger is. So we do various tests to kind of look at yeast markers, Clostridium markers, viral markers, bacterial markers, immune tests. Another big potential trigger in my population is histamine or mast cell issues that create a lot of inflammation. So there might have been an allergic trigger. And then, in terms of treating this, probiotics. Xylitol is a great anti-strep remedy. It is available in gum. It is available as a toothpaste. It can be as a sugar substitute or a sweetener. Xylitol is amazing. They even did a study on a probiotic called Streptococcus salivarius K12. And in children who took it for 90 days had a decreased carrying capacity of strep by 90%.
Wow.
So it was able to clear strep in the pharynx and the tonsils and also prevent recurrent acute otitis media and prevent recurrent tonsillitis. So
is that probiotic, is it readily available?
Yes. Yes.
It is. Okay.
Yeah. We carry it at our compounding pharmacy, but, some of these simple tools, once the PANS and PANDAS is recognized, the key is prevention because we don't want them to have a relapse.
Right.
And so if we can prevent another infection, another trigger, another flare. So again, coming from our biomedical approach, cleaning up the environment, cleaning up the diet, cleaning up the gut. There are herbs that help with infections such as strep. I like to use things like golden seal, berberine, neem. Because I talk a lot about biofilms, I think these infections hide under biofilms, so I have different biofilm protocols that I use. And then because it's an immune disorder, we want to look at immune markers like zinc and vitamin D and vitamin A, and then maybe use immune modulators like transfer factors and colostrum or something called low-dose naltrexone, which helps modulate the immune system. So there's a whole bunch of integrative and holistic ways of kind of dealing with that immune inflammatory piece that's kind of creating that leaky blood-brain barrier, so these kids are more susceptible to getting those antibodies into their brain.
Yeah. Excellent. And so once it's diagnosed and treatment begins, is there an average length of treatment? I'm certain, no doubt that this is all over the board, but what's been your experience with regard to the length of typical treatment?
Well, again, when the kids have this acute onset, we have to start quickly to kind of calm down the immune system, calm down the inflammation. And I actually developed a protocol that we use in our practice that has been really helpful for just treating kind of acute flares. And it's really simple. We just use ibuprofen and diphenhydramine, Benadryl, for about 7 to 10 days. If that doesn't work, then we might have to think about, other things to calm down the immune system, like steroids. And then obviously looking for strep infection, checking a throat culture, looking for other infectious triggers, and then maybe treating that. That's all done acutely. There's another piece to that, is that, immune modulation. And so once we can get that flare under control, then we can work on keeping that immune system healthy, keeping that immune system from flaring again, and then preventing further infections. And because it's a pediatric condition, our goal is to get them through adolescence, to prevent these flares through adolescence. And Dr. Suedo has also developed kind of a prophylaxis protocol using antibiotics like Zithromax twice a week or penicillin on a daily basis through adolescence, because she finds that if you can prevent further flares, the disease will calm itself down. Otherwise, these further exacerbations can make the disease potentially irreversible.
But if you can get them through adolescence, then regression is far less likely, is what I'm hearing.
Exactly.
Yeah.
So when you say how long to treat, again, we need these kids on our radar through their pediatric years, and keep them from flaring, keep them healthy, and keep their immune system calmed down.
Right. That makes sense. So during that period, that youthful pediatric period, all the way up through puberty and adolescence, it's basically a very diligent effort to prevent a flare-up, and if one does occur, to treat it immediately, right?
Right. I think that's another really key point that you make, that if you can recognize the flares early and kind of get into action mode right away, because this is a cascade of events that occurs. I kind of explain it to my patients as like an asthma attack. If you catch your asthma attack right away, it doesn't turn into a yellow or a red. You can catch it, when it's kind of going there. But same with PANS or Pandas. If you can catch the flare right away and calm it down, the whole cascade of inflammatory cytokines and inflammatory markers and inflammatory cells that are released in the brain, hopefully it'll be prevented.
Mm-hmm. Right. That makes sense.
That's why I like to have, when I talk to my families, I say, this is what we're going to do for your child's flares, and each kid's going to be a little different because their triggers are different.
Right. And so with a parent of a child with autism, because they already have, specific neurological challenges, it would seem logical to me that they have to be even more diligent to be attentive to the fact that a flare-up might be occurring. I assume that's an accurate statement.
Yeah, and I know with a lot of our families, they're so hyper-vigilant as to what's happening in their children, but it's so hard because the children are nonverbal.
Right.
And even if a lot of them are verbal, they're not really feeling things like you and I feel. So another big issue that I find is that everybody in the family had strep, but our child with autism didn't get it. But 4 weeks later, 3 weeks later, the OCD is kicking in, and he's never been sick. And I tell the family members, our kids with autism's immune systems aren't regulated the same way. They do not present the same way. They're not going to get a red throat. They're not going to get a fever. They may not even get swollen lymph nodes. Their only symptom may be the OCD. So it's really hard, again, because in another kid, without autism, they'd be telling their mom or dad, I have a sore throat. But so I tell my families, I tell my families, if there is anybody in the family that is sick, anybody in the family with strep, you need to let the school, have the school notify you if the teacher has strep or any of the students in their classroom has it, because then you can be on guard. You can keep an eye on your child to look that, it hadn't flared their underlying immune issues.
That's good advice. Thank you. And what about insurance? Do insurance companies recognize this, and do they support treatment of PANS?
Again, that's why I'm on this committee in the state of Illinois. We're trying to get lawmakers and insurance companies to, again, recognize this is a real disorder that, there's a lot of science behind it. There's a lot of research behind it. And the treatments, the immune treatments for this need to be considered and covered. And right now it's kind of hit and miss. If we diagnose PANS or Pandas and I want a patient to get intravenous gamma globulin, some insurance companies are just saying, well, we don't cover intravenous gamma globulin or IVIG for PANS or Pandas. And, I think that's a real problem right now that we're facing.
And how expensive can that be, for a family to have to cover that expense without the benefit of insurance?
Yeah. It's cost prohibitive. There are some doctors who understand that and, around the U.S. and have, are known for helping this condition, and they see a lot of families who, the insurance won't cover the IVIG for, and we're not able to get the PANS and Pandas under control without it. But even with the IVIG, for some of these kids, they need further immune modulatory treatments like plasmapheresis, and it's definitely a struggle. And I wish it was different for these families, because it's a very difficult disorder, and it's to get the immunologist, number one, to see it, and then to get them on board, because the treatment of this is different than an immune deficiency. The intravenous gamma globulin is not a low dose; it's a high dose treatment. It's not as frequent, but it's a high dose. And again, only certain doctors really understand how to treat this from an immune perspective.
Is that where the Pandas physician network can be helpful that you had mentioned earlier?
Yes, because finding the doctors that understand, finding the immunologists that understand, that they can work with the insurance companies and try to kind of get them to understand that these that child really needs this particular treatment.
Absolutely. And what about? Go ahead.
The National Institute of Health, Sue Suedo, even Sue Suedo is very cognizant of this issue with, getting IVIG, and again, she's trying to develop a network of doctors, and she's trying to educate the insurance companies too to kind of understand that these therapies need to be covered, these treatments need to be covered.
So there's an ongoing effort to get them covered.
Yes. Yes.
Excellent. Well, what about MAPS doctors? Are they, relatively speaking, acquainted with PANS or Pandas and typically or usually equipped to help address the concern?
Yes, they are.
Are they also logically a part of then this Pandas physician network, or perhaps not necessarily? Is there maybe another resource there that, for example, I'm just thinking of families in a state where there may not be a lot of physicians who understand this diagnosis. Is there another resource like MAPS or any others that they could look to get help on a more local level?
Right. So definitely MAPS, because we talk about this condition at MAPS. There's quite a few MAPS physicians that are big proponents of it and are on the Pandas Physician Network as well. So definitely MAPS doctors can help with PANS and Pandas issues. Again, our viewpoint is going to be more holistic and integrative.
Right.
So not going to be your traditional, meds, immune modulators, and it's going to be kind of, more holistic and integrative. The doctors on the Pandas Physician Network are going to be more your classic traditional doctors that are looking at what the National Institutes of Health say are their particular recommendations. So
okay.
It depends.
So
I think the population of people who are listening to this are more holistic and integrative and want to try to do things that they kind of understand that, the immune system just doesn't turn on itself. There are some underlying issues the immune system would do that, and we need to look at the causes of that, and we need to treat the whole system, the whole body. Now, people who understand that, I think going to a MAPS doctor would be a better way of handling this disorder. But people who are more traditional, who think that the meds are going to kind of handle this problem and really don't want to kind of get into the whole idea of supplements and anti-inflammatories and omega-3s and diet and all of that, then finding a more traditional doctor that understands Pandas and PANS would probably be the way to go.
Well, you bring up diet. Can we spend a minute on that? In your opinion and experience, does diet, what role does diet play in preventing these flares? Is it significant?
Again, it hasn't been studied, but in my experience, just like with the children with autism, the casein-free, gluten-free diet has helped 67% of children with autism. It is a diet that's an anti-inflammatory diet. The casein-free, gluten-free diet is also very low in glutamate. And one of the potential neurotransmitters that is stimulated with obsessive-compulsive behaviors and all this excitation in the brain is a neurotransmitter called glutamate. And so I talk to my families, again, about how important diet is. You really, really want to avoid highly inflammatory foods. And again, the big inflammatory foods are gluten, dairy or casein in particular, and sugar. The other big food in this condition are foods called, or actually substances called excitotoxins. Excitotoxins are substances that stimulate the brain. They excite the brain. And as I mentioned before, the brain's already hyperexcitable in this condition. So these excitotoxins fuel the fire. Things like caffeine, MSG, monosodium glutamate, NutraSweet or aspartate, red and yellow food dyes, nitrites, sulfites, benzoates. They're all very excitatory in the brain. So we want our patients to avoid that. And the other food item that is sometimes detrimental for these kids are foods that are high in something called amines, A-M-I-N-E. So the classic example would be high histamine foods. Remember I said dopamine is an issue for these kids, and dopamine is an amine. Histamine is an amine. Serotonin is an amine, and all these are dysregulated in this population. So there are certain foods that are high in those, and I don't want to add, again, more of that to a burden, the body that's already kind of high in that. So we ask our patients to kind of lower their intake of high amine foods. And a big high amine food would be fermented foods. Fermented foods are very high in histamine, for instance. So some of these children, even though I love fermented foods, some of these children don't do very well with something like kombucha, for instance.
Interesting. Wow. And so I would imagine in many cases, parents, when they don't find success with their pediatrician, they began to investigate, the causes of the symptoms that they're witnessing and watching their children exhibit, may suspect at some point that their child has pandas or PANS, but they don't have an official diagnosis. What would you recommend to those parents?
If they suspect it, they need to find a medical professional that will work with them to kind of do the workup, to figure out what the potential triggers are, and to help deal with what's going on in the immune system. At the same time, deal with their comorbid symptoms. Deal with the anxiety, deal with the mood, try to get whatever behavioral therapies and cognitive therapies in place to help the children. And many of the therapists that they work with already can help them with that piece.
Right. I would imagine, though, that if the suspicion exists, that it's not likely they'll get the complete help they need from their family pediatrician. They could get some help, as you just expressed, but there's going to have to be an effort there for them to track down a doctor who really understands this particular issue. Yeah. Again,
I think more and more doctors are seeing it and recognizing it, and but like you said, people in rural areas, people who don't have access to bigger cities where there might be more integrative physicians, they may have a little bit of a rough time. So in our practice, for instance, we see patients from all over the United States and all over the world, because there is such a need for doctors who can understand and treat this.
That's understandable, and so our time is quickly approaching. It's been a fascinating topic. We really appreciate you taking time out of your busy schedule to spend some time with us, actually this evening. So thank you for that. But before we go, how do people find out more about you, about your practice? Is there a resource that you recommend that they can go to learn more about the treatment and diagnosis of Pandas and PANS?
As I mentioned, some of those websites like the Pandas Physician Network and the Pandas Network, they're just great. They have a lot of information. They have information there about talking to your schools, talking to your teachers about this. They have articles, so there's a lot of information at those websites. And in terms of me, I'm in Naperville near Chicago at True Health Medical Center. And I have a website, www.truehealthmedical.com. And I'm also owner of a pharmacy called Pure Compounding Pharmacy. I had my pharmacy because I have my own children have some of the health issues, and they're extremely sensitive to things. And so even just using something like ibuprofen, as I mentioned before, for flares, if you're going to use something like ibuprofen or Benadryl, just make sure that it's clean. We don't want to add those excitotoxins and aggravate the problem. So, watch out for the dyes, watch out for the fillers, and when you're using products, use really clean products. So just
Can these clean products be found in a Walgreens or a CVS when it comes to ibuprofen or?
Well, you can find dye-free ibuprofen and dye-free Benadryl or diphenhydramine, but they might have some other ingredients. And again, I have some patients who are super sensitive, so I end up having them fill prescriptions, compounded prescriptions for ibuprofen and diphenhydramine, just to be safe.
And you can do that in your compounding pharmacy?
Yeah, but people can also do that in their local compounding pharmacies.
Okay. Well, I live in Southwest Florida. I can tell you there's not a lot of options where I live for compounding pharmacies. But if you head over to the East Coast of Florida, Miami, Lauderdale area, the options, are there. But I'm certain a lot of people. Our pharmacy can ship to many of the various states. We have licenses in a lot of different states. So, right.
If your doctor writes an order, we can fill a compound there.
Excellent. Well, Dr. Usman, this has been very helpful, very educational, and we want to thank you again for being a part of the Autism Hope Summit for the second year, and we certainly appreciate all you do to help children. So thank you for taking time out of your extremely busy day to help educate parents, who are looking for answers. We thank you.
You're welcome. Thanks for having me.
You're very welcome.